This is Boomer Life on CL 650.
Welcome back to Boomer Life on CL 650. I'm Joanne Sutton, and joining me in the studio today, we have Dr. Chris Coburn from SmartShape Weight Loss Centers with facilities right across the country. And basically, this is an outfit that will help provide options for you for weight loss if it's something you've been struggling with your entire life. And we've been talking today about 3 of the top programs that you offer at SmartShape. If you could just outline them once again for me, Dr. Coburn.
Thanks, Joanne. Yeah, so at SmartShape, we offer 3 programs. We emphasize the word program because it's much more than a procedure. It's a procedure coupled with an extensive follow-up program with a well-trained professional team of counselors, dietitians, nurses, coaches that help people achieve their weight loss goals. But the 3 programs that we offer center around the lap band, the gastric sleeve, and the gastric balloon.
Tell me a little bit about the team that you work with. You say that you provide all this support for someone who comes in and signs up for one of your programs.
Yeah, so again, we have an experienced team of nurses across the country who do the adjustments of the lap band. We have coaches and dietitians based centrally. We have online support groups. We have webinars that we offer to our patients because we look at these, again, as much more than, or basically these are tools. These are tools that allow you to be satisfied with smaller portions of food, not have the hunger that you have with diets all the time. People who are on diets are asked to choose smaller portions of food, but they have to fight the hunger with willpower. What we're doing here is using the lap band, the sleeve, or the balloon to induce a sense of being full or satisfied with smaller portions, so the hunger is not the problem.
So for those of our listeners that might have been struggling with weight issues their entire life, they walk into your clinic or they can go to your website at smartshape.ca and have a look at some of the options available to them. They've consulted with their own personal GP, their doctor, and now they've decided to take another step. What would they expect when they first come to see you?
Again, so education, I think, is probably what we pride ourselves on at the beginning. Educating people, informing them as to what their options are, what they can expect, so they have realistic expectations of what these procedures and programs involve, and what does success look like. Because success is a very interesting subject. We've come to learn that success is not measured by the number of pounds that you lose. In fact, we want to encourage our patients to figure out why they want to lose weight in the first place. It can be the way they look, the way they feel, the things that they're able to do, health issues such as diabetes and blood pressure and cholesterol that may get better with weight loss. But you need to spend some time thinking about that because that's where success comes from, is not the number of pounds.
So you'll actually talk to them about what their goals are and what they want to do. And, they come in, a young woman comes in at 300 pounds and she says, I need to lose 100 pounds.
Yeah.
What are my options?
Well, we would tell them they don't need to lose 100 pounds. They need to do something about their weight. Where do they want to be? How do they see themselves? What is it they want to accomplish? It's very interesting, the differences between men and women and what their goals are. Obesity, 80% of our patients that we perform procedures on are women because it's much more socially unacceptable for a woman to carry extra weight than it is a man.
I was going to ask about those differences. Why don't you see men come into your center?
Because I think for men to be a little bit overweight or to be obese is okay. They don't suffer the social stigma that the women do. So the most common reason we see men come in is that they maybe they've been married and now they have a child and they start to see life as becoming a lot more serious and they see how their weight's going to affect them. Interestingly, excess weight is far more dangerous for men than it is to women because as men we tend to carry the weight centrally in around the organs, if you want. Women tend to carry it more peripherally on their, on the hips and the buttocks and the abdominal wall and so on. And that's actually not the dangerous fat that men have. So by the time men come to see us, they tend to be more advanced along the health problems that obesity causes.
So let's talk about the average CL listener. Maybe not the average CL listener, but just say we have a 60-year-old male sitting at home, an excess of 40, 50, 60, maybe even 80 pounds. they've just had their first grandchild born. They're not able to run around and play or engage
Well, I think
like they want to.
With the 60-year-old, it's likely an issue that their knees hurt and their hips hurt, and they can't move around the way they did, or they have sleep apnea. They can't breathe properly. They're using a walker. So figure out what those issues are that the weight is causing, and then talk to us about which option do we think might help you best to provide a safe and effective option.
Now, when you talk about the three different options that you offer, the lap band, the balloon, and the gastric sleeve, is there a better success rate for either one of them?
Again, we come back to what is success. So I think you have to present realistic expectations of what can be achieved, and you have to present these procedures in the light of, as far as safety, as far as effectiveness, as far as goals, and so on. And we work with patients to try and decide which one seems to make the most sense for them.
Okay, it does. It keeps coming back to that. So the majority of procedures are done laparoscopically, but the gastric sleeve is actually a surgical procedure. Is this correct?
Well, both the lap band and the gastric sleeve would be surgery, in that they involve making small incisions and looking in with the telescope. All three procedures basically involve general anesthetics, so it depends on how you define surgery. But the gastric sleeve is a more invasive procedure because it does involve actually removing part of the stomach.
Is there any level of pain involved with these? I hear surgery, I think pain.
Not much. I mean, there's a little bit of gas, a little bit of bloating. A lot of the listeners may relate to having had their gallbladder out laparoscopically.
Isn't that just middle-aged? A little bit of gas, a little bit of bloating?
Could be, yeah.
Sorry.
But so anybody who's had their gallbladder out in the last 20 years has had it done for the most part laparoscopically. We would equate the recovery with the lap band very similar to a laparoscopic gallbladder removal. The gastric sleeve, again, is it requires a couple of days in the hospital for observation and may involve sort of 7 to 10 days of recovery rather than 2 to 3 days of recovery with the lap band.
And then how long before you just sort of kick back into your regular lifestyle? You're, running around with the kids or engaging in sports or activities or out for dinner with your friends. Are there any limitations to that? No,
because these procedures are done laparoscopically, there's really no physical limitations down the road. One of my favorite stories is a 17-year-old fellow who I did a lap band procedure on, and within 6 weeks he was playing college football in the U.S. So that to me was an indicator that there really are no limitations from a physical point of view. The weight loss tends to be a little more gradual with the lap band. We're looking 1 or 2 pounds a week, a little more rapid with the gastric sleeve, but at the 2-year mark, the results are probably very close, provided somebody uses their band properly and has access to the full range of health professionals that they have at SmartShape.
Now, really, when it comes to just our general level of education on these matters, all we have to go to is what we've seen on TV or read in a magazine. But isn't it common knowledge that rapid weight loss is not really all that safe or smart, or does it need to be monitored by a doctor? Or?
Well, rapid weight loss, unfortunately, if it's too rapid, it involves losing muscle mass rather than just fat. At 1 or 2 pounds a week, the kind of weight loss we get with the lap band and the gastric sleeve, we know that individuals will burn fat and not lose muscle mass. In fact, they tend to build muscle mass at the same time.
Well, Dr. Coburn, you've provided us with a great deal of information about laparoscopic surgery and weight loss options here. There's a lot to digest, so to speak, but and maybe a little bit overwhelming for some of our listeners. It is. You've given us a lot to think about.
Yeah, it shouldn't be overwhelming. I mean, again, we encourage people who are interested in these procedures we have at SmartShape, see our website, talk to our advisors, get a free consultation, get the kind of education and the information you need to make a good decision about what is both safe and effective. Choose a clinic, choose a band that's FDA approved band. Get the right kind of help afterwards, and I think you get the kind of success that we see.
Do you still perform the surgeries yourself?
Yes, I do. Yeah, I do a significant portion of the lap band procedures at our clinic in Mississauga. Having said that, I've trained the surgeons at our clinics in Calgary and Vancouver, and I do the surgery in Winnipeg and Regina. So we have a full range of surgeons and facilities across the country. Don't let distance or don't let your geography be a barrier to achieving this kind of success.
And don't measure your success in pounds.
Right, exactly.
I'm going to go home and write that on my mirror in the bathroom. Right. Can you tell us and remind us once again of why this is so important? So, like, at this time, at this age, at this place in our life, as baby boomers, obesity looming, diabetes looming.
Obesity is the number one cause of preventable death in North America. It now surpassed smoking. So this is a problem that you're not going to get away from. If you're overweight or obese and you're starting to get health problems, they're not going to go away. Unfortunately, the traditional prescription of diet and exercise is rarely effective at achieving this kind of significant and sustained weight loss. So if you want to do something permanent, if you want to lose weight and keep it off, you need to consider options that are more permanent in nature.
And SmartShape weight loss centers can offer you those choices.
We do, and we do them well.
So, Dr. Coburn, really, if we leave with anything today, it's the fact that SmartShape can provide options and solutions to some of the weight loss struggles that maybe we've experienced of late or our entire lives. And it's not something that you have to go through alone, is it?
No, it isn't. In fact, we encourage family members to be a part of the solution. It's interesting when one member of the family has undergone one of our procedures or in one of our programs, we find there's a bit of a rebound effect because the rest of the family starts to eat slower and chew their food well and maybe make better choices. So there are beneficial effects on the whole family, even if only one of them has had a procedure.
And, of course, we have clinics right across Canada to look after us.
Yes,
Should
we
we change, decide to move or relocate in our retirement?
Yeah, especially with the lap band. SmartShape has trained nurses and physicians in probably about 80 communities across the country where they can get the band adjusted. A lot of the care is still provided from our team of professionals, but when you need the band adjusted, we have somebody nearby wherever you are, anywhere in British Columbia. We have nurses and physicians who can do the band adjustments.
And your procedures here in Vancouver?
We do lap bands here in Vancouver, yeah. We do, at the Falls Creek Surgical Center, like we've mentioned before.
Like other procedures, are there long waiting lists to get in for these types of programs?
Well, there certainly are in the public system. It's one of the limitations of the public healthcare system is that there is only a limited number of resources and great demand. So the wait list tends to be very long. Because we're an independent or private clinic, we don't have those wait lists, and so we can provide these procedures in a timely manner. As an independent clinic, our procedures are not covered by provincial health plans. There's a limited amount of funding that may be available for some provinces. But basically, these are procedures that are self-pay, but we find that it's really very motivating for patients to be able to contribute to their own health care.
So if somebody wants more information, smartshape.ca is the place to go. I think there's even YouTube videos you can watch, isn't there?
Yes, there's, of course. We've got the whole gamut of videos. There's some very well done, I think, professional educational videos about these procedures that we offer our patients prior to surgery. Again, what's important in SmartShape is that we make sure people understand these are tools. They're very effective and very safe tools that allow them to achieve significant and sustained weight loss, but they need to be viewed as that. They need to be viewed as part of a program, not just a standalone operation.
Dr. Chris Coburn from SmartShape Weight Loss Centers, our resident expert in laparoscopic surgery to offer you weight loss options. Thank you for joining us today.
Thank you very much, Joanne.
You're listening to Boomer Life on CL 650. I'm Joanne Sutton. Today, we've been speaking about your health and your weight loss options, joined in studio by Dr. Chris Coburn from SmartShape Weight Loss Centers. For more information, once again, smartshape.ca is where you can go. Thanks for being part of our program today on CL 650.